Hi everyone, welcome to our latest episode of PPIE in Practice. Today we're speaking to Dr. Jadine Scragg, a researcher from the University of Oxford, who's here to share more about her research on polycystic ovary syndrome. Thanks very much for speaking to me today. Firstly, would you be able to share a bit more about polycystic ovary syndrome and what your research was about?
Absolutely. So polycystic ovary syndrome, or PCOS, as I'll call it going forward, is a condition that affects how women's ovaries work. It can cause problems with how their bodies may control blood sugar, and many women who live with PCOS also live with obesity or overweight as well, and they find it particularly hard to lose weight compared to people who don't. We spoke with people living with PCOS to find out a bit more about this, and they said that they've always found it really tricky to learn more about the best ways to help them lose weight and how helpful that might be for them. So in this project, what we did is we had a look at all of the evidence from published randomized control trials to see how weight loss might affect PCOS and to maybe start to get some insight into what sort of methods might be helpful to help people achieve weight loss and if that might be helpful for their symptoms.
Sounds really interesting. My next question is, who was involved in the project and how did you involve them throughout?
Yeah, so we worked with people living with PCOS. So we collaborated with a charity partner, Verity, and we used some other kind of PPI resources to help us try get as big a reach as possible. So what we did is we spoke to women living with PCOS at the start of the project, throughout the project, and at the end. At the start, we asked them specifically what they felt were the most important outcomes. So what might represent an improvement in PCOS for them. And that's really important with PCOS because not everybody experiences the same symptoms. So this was really useful for this project. Along the way, and particularly at the end, we presented the results back to them and our findings. And the reason we did this was to find out more about the best way to talk about the findings and also to work out to them, these people living with PCOS, which findings were most useful and helpful for them.
I guess reflecting on the public involvement you did within this project, what impact do you think these activities have had to date?
We, to be honest, we couldn't have done this project without speaking with people living with PCOS. It was absolutely critical to ensure that we captured and focused on the outcomes that actually matter the most to patients, which is not always the same as what's necessarily reported. So that was really helpful for us. I also personally learned a lot about the best way to talk about the outcomes, and it also helped us work out the best ways of making the findings known to people living with PCOS. So we got an idea of where they might find information about, things that they could potentially do or ask about when thinking about management of their PCOS. What was really nice is we did find that the people who we involved were really, really excited at the opportunity to do so. They particularly mentioned that PCOS is quite under-researched, so they thought it was a really good opportunity to potentially shape research and to have more of a say about the kind of things that we talk about when doing research with PCOS.
I wondered if you had any advice about public involvement and engagement that you'd be happy to share with others.
Yeah, definitely. I think for me, my main learnings would be to approach it with a completely open mind. Because of this project being a systematic review, I went into it feeling quite confident that I would maybe know what people thought were important, but actually I was proven completely wrong. Um, so my conversations were really eye-opening. They taught me a lot about the ways that living with PCOS can impact their day-to-day lives, and that was things that I would never have known about had I not spoken with them. Um, I also wanted it to be as accessible as possible to everybody, so I really learned a lot as I was going about giving each other time and flexibility. Because some of the things we talked about were potentially quite sensitive, I didn't want anybody to feel rushed. So I worked really hard to make sure that there was plenty of time to build rapport and have conversations and make sure that it was as a relaxed environment as it could be. Um, I worked really hard as well to try and make myself available when other people were. So this did mean that some of my conversations did happen, on Sunday afternoons or something like that. But without doing that, I wouldn't have been able to speak to half the people that I ended up speaking with. And I also budgeted as well, so I could reimburse them fairly, as they are giving up their very important time and experience. And I also budgeted to make sure that if need be, I could reimburse them for any carer costs or any accessibility costs to help them access the internet or anything like that as well. Which I'm really glad that I did, because that really, well, there's always more that we could have done, but it helped people make the time to be able to speak with me.
Yeah, no, thanks for sharing. That's really, really nice advice. I've just got one final question for you, and that's what do you plan to do next?
Well, if I had a magic wand, I would say that I'm going to go full steam ahead. But the reality is, because of all the conversations and engagement that I did as part of this project, I'm really, really fortunate to have a group of people living with PCOS who are super motivated and excited to help me go forward. So based on the results from the systematic review and the things that I've heard from people living with PCOS in our conversations, my next step is to apply for funding for a trial where we work together to kind of create a suitable weight loss program, which, based on what we've heard, might be delivered through primary care. That's where PCOS is predominantly treated and managed. So my plan is to apply for funding for that and continue to work closely with people living with PCOS to make sure that program, hits the spot and works well for them, to make sure it gives them all the support and information that they need. I'll continue to work with some of the people that I've already been working with, but as always, I want to keep it as open to everybody. So I'll expand further on my network that we've made.
Sounds fantastic. Thanks very much for joining me today, and best of luck with the next steps as well.
Thank you.